My name is Scott Ball, and I'm a senior project manager with Dwani Plater-Zyberg, and I run our Lifelong Neighborhoods program, and will be the moderator for this presentation, which is looking at moving lifelong neighborhoods to scale. We have two great speakers with us today, and we will work from the sort of macro issues of policy and population change to, I'll do a little bit about policy and at the community scale, and then Robert will finish up speaking about work at architectural and community scale. So we will start at the big and work towards the more intimate details. Robert Jenkins is the he directs the NCB Capital's Impact Greenhouse Project. He's the vice president of the Community Solutions Group. Prior to coming to the Greenhouse Project, Robert directed a thing called Coming Home, which was a widely covered and a very exciting program that looked in 9 states and 42 demonstration sites at creating affordable alternatives for individuals eligible for nursing home care under the Medicaid program. And instead it allowed them to work in more assisted living kind of facilities. Really interesting program he had done before that. And then the NCB Capital program he's working on now, which is the Greenhouse Replication Project, is in a way a follow-up. It's both funded by Robert Wood Johnson Foundation. Robert is an extremely educated and diversely equipped thinker. He received his Bachelor of Architecture from Cornell College. He then went on to study real estate development at MIT, and then public policy at the Harvard University's School of Government. All of these things come together in the work that he does now. He has a fascinating life that consists of writing policy, federal policy, in the morning, and then getting a project built in the afternoon, and having something peer-reviewed occasionally. So he straddles many different worlds. Catherine Lawler, who will open up our talk, has been a co-conspirator with DPZ on the lifelong communities and lifelong neighborhoods work from the beginning. She is the Director of External Affairs, or the Manager of External Affairs for the Atlanta Regional Commission in Atlanta, Georgia. It's both MPO and the AAA, the Area Agency on Aging. And we did a project with them in 2009 that looked at aging and community planning at a regional scale. And that has been sort of the kickoff of a lot of this, getting a lot of this work onto the ground, both in the Atlanta region and in other places. Prior to this, to working at the Atlanta Regional Commission, Catherine was a consultant to local governments and foundations, and worked primarily in issues dealing with older adult populations and community-based care settings. She worked for ARP and Robert Wood Johnson and many of the big firms. From 2000 to 2006, Catherine was the Director of Aging Atlanta, which was another Robert Wood Johnson funded partnership consisting of 50 organizations focused on preparing the metro region for the rapid growth of the older population. Also a diverse background in both public policy, has a degree from Harvard's Kennedy School, and served as a fellow at the Joint Center of Housing Studies in 2001, and as well has a bachelor's in religion and government from the University of Notre Dame. So we are going to start off first with Catherine's presentation, which is going to look at macro issues. What is the issue that when we're saying moving to scale, who is it we're moving to scale for, and what is the context at a national level in which we're starting? And if you could get that conversation going.
Great. Well, it's so nice to see you all. Thanks for being here, and I hope that you'll be as interactive as you're ready to be today. It's much more interesting if you go ahead and ask a question when you have it. So as Scott said, I'm going to kind of begin us at the beginning. And who are these people and what do they want is some of the questions we want to look at real quick. But I like to always remind everybody that while we're here to talk about a changing population, we're not necessarily here to talk about aging because nobody comes if that's what you're here to talk about, but we are here to talk about birthdays because we're here to talk about birthdays and a lot of people having them and a lot of people having them at the same time. And what does that really look like across the country? And you've seen these numbers before, I'm guessing, but it's never bad to look at, and every time I've seen them, it's always surprising to take a look at how steep some of these graphs are. But we're looking at really dramatic and absolutely, and this is the important part, unprecedented growth in the older adult population. We've never been through this before as a country, and it's happening all over the country. You can just take a look at it by county, where we're looking at the percentage of the 65 plus population now and how that's planning to grow in the future. So really tremendous growth in the population that's not only making us an older community, but it's really changing our whole household structure. And again, I'm guessing these are numbers you've seen before, but it's always remarkable to look at what we're looking at and how this has changed and really how it's changing in such a dramatic way over such a short period of time. So just looking at household structure, when in 1960 you had about 50% of people have children in their home, and looking forward we're looking at less than a third of households having children in them. So a change in our communities. And again, just looking at the share of household growth, how that growth is really going to happen in households without children. And what kind of impacts does this have? So it's a growing older adult population that's not just about having more older people, but it's really about a transformation of our community structure. So I think it's sort of, why is this happening? Well, one, it is happening because of the baby boomers, and you've heard plenty about them. Maybe we have many of them in the room here. That certainly is, in raw numbers, that the growth in the older adult population is coming because we have this tremendous population that's beginning to move through this segment of their lives, and that is part of it. But another big part of it is about longevity. And this is just a reminder that the experience of growing older is a relatively new concept. In the early part of the last century, we just didn't live very long. And those who did live very long were a very small part of the population. So life expectancy of the turn of last century was barely at 50. And in just 100 years, we're looking at life expectancy expanding to almost in the mid-80s for women, which is really a tremendous change over a very short period of time. And it certainly isn't to say that we didn't have old people before, but this idea of aging at this scale is not just because of the baby boom population, but it's really that the opportunity to age is a relatively new phenomenon. So again, I think you then have to ask the question, who are these people and what do they want? And in order to understand how this change is going to happen. So who are these people? Well, the first thing you have to do is not say these people, right? Because they're a tremendously diverse population. So if we look at people who are 80 today and the year in which they were born and some of the things that would have been happening then, and often included in the 50-plus population would be people born in 1962, the 50-year-olds of today. And what are they experiencing and the experiences that they came from. So we're talking about multiple generations of people when we talk about older people. And it's often best to begin the conversation by beginning to break that down. So they are not a uniform group they don't have uniform desires. They don't have uniform experiences that they're bringing to aging. We also know that at the same time we have a whole new experience of being older. This is a survey that was done asking different generations of people how sexy did they think it was to be 75. And you can see that boomers and 65-year-olds actually think it's pretty hot to be 75. And so these are sexy, active folks. And interestingly, you know, if you look at that yellow line, the younger population who didn't think it was so sexy to be 75, well, it's when you have the bulk of the population or a huge part of the population moving into those older generations, our ideas of what it means to be older, our ideas of what it means to market being older is really different if most of the people are thinking that it's a pretty hot time of life. At the same time, though, older adults do have issues, and we have a frail segment of the population. And this is an interesting part of a survey I'll tell you a little bit more about that Gallup is doing, really measuring well-being over time. And you'll see that when it comes to people who rank in sort of a struggling or suffering in terms of an overall life evaluation index, older people do rank higher in that. So you have sexy, but you also have frailty. You know, just looking at health status, we do have a number of significant health trends that are not trending in the right way when it comes to the older adult population. So while they are active, we do have real health concerns, and that are very much a part of their lives. Again, at the same time, so you really have two parts to the story. We have the wealthiest older adult population that we've ever had before as well. So we do have a wealthier population and a much more highly educated older adult population. So if we've never really aged before, we've never really aged like this before either. So while we do have low-income people, people who have pretty significant health issues, and at the same time, there's the other end of the spectrum. And this is a sense of who these people are. Well, on the question of, well, what do they want? It's important to know that nobody says they want to grow old. It isn't aging as an outcome. It's really well-being. It's about doing it well. It's about quality of life. And that is what people are after, is well-being at all ages, and particularly as they grow older. And if you ask them specifically, that is what they describe the most. It's about quality of life. And that is true across incomes, across educational spectrums. It's true across different levels of frailty, that it is about quality of life and how that can be defined at those different levels. So just to tell you, Gallup, and if you're interested at all, you should check it out. It's at wellbeingindex.com. They are doing the most fascinating study where for over 25 years they call 1,000 people a day, and they are measuring well-being in the United States through a whole number of factors, including actual questions about health, but also about your perceptions on health. And this just gives you a sense of how the different states are ranking. They've done this now for several years, and so they've got really significant data. And some states certainly rank better than others. We live in Georgia, and so just like our other counterparts in the Southeast, we tend to linger in the bottom. And this just looks at that breakdown by different smaller geographies, so you can get a sense of it. Even states themselves aren't uniform. You might be interested to know, do you know what the day in the United States where we have the highest well-being? This is tracked over a number of years. Any ideas? It's actually one day out of the year where we have the highest well-being. It's Thanksgiving. Do you know what the lowest day of well-being is? It's Valentine's Day. But anyway, this is fascinating work, and you should look at it because it's really asking the question, people with higher well-being actually have better health, and that's at different levels of frailty. So it's not just one standard of health where you have to be, an Ironman athlete to be considered healthy. It looks at health in all different ways of defining them, and well-being is the largest indicator. So this is just to give you a taste of that data. Well, so the question then is how do people achieve well-being as they grow older, and why are we even talking about this? We're talking about it because it's actually really hard to do. And the hard to do part is all the stuff that people at CNU know really well, and that they are aging in environments that were built with absolutely no consideration of growing older, right? So we had this whole phenomenon of a century in which health and science did tremendous work to make it possible to live longer. And at the same time, we had the largest expansion of our infrastructure, and all of that infrastructure was blind to the idea that we would grow older. So billions and billions of dollars being spent pretending that these guys over here in the medical field weren't making it possible to grow older. It's really extraordinary, the idea that we would put those kind of blinders on. So here they were making it possible to grow old, and here we were building communities that were actually impossible to grow old in. And you know all of these details, much of which is quite ugly and very difficult. And this is the challenge of well-being and aging, is not that people don't desire it, not that they don't know how to define it, but in fact, they are in environments in which it becomes very difficult to achieve, right? This actually boils all the way down to the world that I come from, which is aging, where we've been delivering services to older people that, quite frankly, they don't want either. We have in this country as many senior centers as Starbucks, which is actually a remarkable statistic, and they are becoming very unpopular places because even the basic services that we have committed to delivering to older adults often miss the mark. And certainly it may not be the places that you or I want to go as we grow older as well. So some early indications of this tension, right, that people obviously want to grow older and want to grow older in a place where they can achieve well-being, but yet they find their environment is not a place that facilitates well-being. Early indicators of this are just about the prevalence of chronic disease and the staggering future costs of treating that chronic disease. So aging with chronic disease, and what that's simply going to cost us, let alone the challenge it makes for well-being. And people started to see this inconsistency, and I'm delighted to be on a panel with people I know who were seeing this inconsistency almost 20 years ago. I mean, I think some of Robert's earliest work that I read was from the mid-90s, and certainly I know Scott got involved in 1998. People began to see that this was not making sense. People were not able to achieve what they were hoping to achieve, and growing older should not have been so hard. And so I like to call this everyone's sort of 80s hair moment, where you say, oh my God, what were we thinking? You know, I mean, that is really, how could we have possibly built these environments while it was so obvious that the only thing you can be sure of is that you're going to be older by the time we're done this talk than when we started it, right? It's this absolute guarantee, and we ignored it. And this early, the 80s hair moment started to happen with some of these great people that you've got here. And it started to happen in small pockets all across the country. And I was delighted to be a part of, in the organization I work for, the Atlanta Regional Commission, Scott mentioned, we were able to partner with DPZ over a number of years and work on an initiative in Atlanta that is still going great guns, really looking at how do you create lifelong communities, and mostly how do you retrofit lifelong communities, because people are where they are and they want to be where they are now, and how do you make this happen? But this work in Atlanta is really part of a whole series of pilot projects that have been going on for about 15 years, doing phenomenal work. Programs that you might be familiar of, looking at naturally occurring retirement communities, the Villages model, which we'll touch on a little bit later. You know, really innovative work about integrating housing and services, so where you had senior housing developments and how you could get innovative services into those environments. Aging in place, the World Health Organization has embraced an age-friendly cities initiative, all kinds of really fascinating pilot work that I think has been phenomenal and has shown really tremendous results. And with the pilot projects, you've been able to see this work influencing how we think, and then this really nice cycle that has occurred over the last 15 years, where even the earliest ideas in the early 80s about what it could mean to age in the community have evolved so significantly that there is tremendous examples of how this can be done well. How whole systems, and you're going to hear about some of this from Scott and Robert, systems that people thought could never change have actually completely reinvented themselves. But the challenge with pilot projects, and it's been really wonderful work, but what we want to talk to you about today is this is great, but we kind of find ourselves right here. And I think if all of this wonderful pilot work hadn't been going on, this guy wouldn't even have the umbrella he has, and maybe not even the tools that are in his briefcase. So it's really positioned us well. But the pilot works, if that is all we ever end up doing, then we have really a tremendous set of answers for a very few people. And what we have to get to, and really want to delve into with you today, is how do we get to some very targeted, effective answers that can really reach many different people. So it's not just a lot of answers for the few, but it is really targeted answers for the many. But we do know from this pilot work that we need a different type of community. We need communities where it's easier to get around, where there are more choices and more options when it comes to housing and transportation. And we fundamentally need a different way of delivering services. The services that are important to maintaining quality of life as we grow older. There were some early experiments in the 60s and 70s and 80s, but they have resulted in some things that have been highly undesirable. And if you ask people, older people, what they're most afraid of, they'll tell you usually it's a nursing home. And so that model is not necessarily been one that has worked. So I want to sort of lay out maybe, and then we'll talk about further, what does it mean to move to scale? Well, there are a number of parts to how we could do this, but for our conversation today, first part is learning how to spend the money we're spending well. Something we might have thought about in the 60s and 70s when we were doing all of this building, the 80s and the 90s. If we had just spent the money we were going to spend and we had spent it well, fully aware of the full lifespan that we are now have the great opportunity to live, that we might have actually ended up in a much better place than we find ourselves today. So we have to learn how to spend the money well, and this breaks down into having options, but also into having communities that are much easier to move around, to be in and move around and do the things we want to do. This diverse older adult population, all of whom are going to want to do different things, but really continue to find themselves trapped without any kind of accessibility. And then the other key category of moving to scale is about full integration. older adults cannot be a special population anymore. In fact, it might be CNU's goal not to have, at what point will CNU not have aging sessions, but aging will be talked about in all of its sessions, because it's about serving all people of all ages. And it's true even in the place where I work, which is both the Metropolitan Planning Organization and the Area Agency on Aging. And the older adults actually used to be about a page-and-a-half appendix on our 2,000-page regional transportation plan. And now, as of last summer, they are fully integrated into the entire 30-year plan. So that kind of evolution where they cannot be a special population group anymore. And that, at the heart of it, is going to take all of us looking in the mirror and changing the way we practice. What is it about our own professional work that's going to have to change to allow that integration to happen? So we're looking at how do you spend the money well. And that has to do with policy, but it also has to do with good design, good thinking, good planning ahead of time, and learning how to integrate and not segregate anymore. I want to kind of just leave you with, there are some things really have gone to scale in this country when it comes to the older adult population. We have made a lot of, there is a massive federal policy that dictates about accessible environments, and that certainly has gone to scale. So we're going to look at that a little bit more. Scott's going to lay some of those details out for you. Nursing homes have definitely gone to scale. I mean, they didn't even exist in the early 60s, and they are at scale, and many, many people are afraid of them. So Robert's going to talk to you about another whole project that is about rethinking those issues that have gone to scale. And I mentioned to you senior centers. They have gone to scale as well, but they are ripe for transformation, and there are some interesting pockets of work going on across the country about how we could do that. But it is a process of invention. We are at a very, very exciting time. It isn't something that we get to look back and see how it was done before, because the opportunity to grow older is a relatively new experience. But I do think it is really time to move to scale, and how can much larger groups of people take this wonderful pilot work and take it to the level where it needs to be. So I'm looking forward to Robert and Scott kind of doing some of the deep dive, and then your questions later.
Okay. I'm going to talk a little bit about accessibility. One of the things I think that's been hard about talking about this topic over the years, about talking about lifelong communities and lifelong neighborhoods, is that the best possible thing that new urbanists could do is simply more of what they've been doing since the mid-'80s. And there's nothing more boring for a CNU crowd than to hear that really what's needed is communities with a center and an edge and retail and mixed uses. They really want something new. So if we accept that we continue working on what we're doing, and that is the absolute most important thing that can be done right now for more age-friendly and more successful aging communities, then a next thing to think about, and perhaps that may help us do this, is accessibility regulation. And I've, of course, thrown up the book that just came out 2 weeks ago. It's a shameless plug. Deals with a lot of these topics. Robert writes an introduction, and Catherine writes a first chapter. So accessibility, why talk about this right now? And this is a Where's Waldo? I don't know if anyone found those diagrams, and it had those diagrams as a child, but the issue of disability is completely, the demographics Catherine has talked about, completely change the shape, the face, who is the disabled population. It is completely undergoing transformation. We're in a very different spot. So the opportunity to ask, who is the disabled population, in a legal context. ADA is through the Justice Department. It's a civil rights issue. And to redefine who that person is, that disabled person is, also opens up a significant opportunity to redefine how it's addressed. And that is where we are right now. We can no longer maintain the ideas we've been working under for dealing with the disability population. Interesting statistics. 19% of the entire U.S. population is disabled at any given time. But that is, in legal world, that is the protected class. It's extremely interesting in disability because unlike any other protected class, it's a time-shared class. 60% of all people, the average is 60% of all people will become disabled for some period in their life. So that 19% of the population contains the majority of us at some time or another, and if you figure in your relationship to giving care to loved ones, it actually affects us all. We all move through that 19%. Very unusual for a protected class for it to cover the majority of us. Now, today, 68% of the disabled population is above the age of 78. So never have you seen an issue that is so heavily weighted to a single demographic. It is an older adult issue. As the baby boomers retire and become more frail, that number will substantially climb. You expect to see things in the 80% of the entire disabled population will be an older adult population. Interestingly, that 95% do not use a wheelchair. It's current. That will increase as well. I think one of the most interesting things in dealing with disability right now is that it is impossible for us to acknowledge the impairments that any medical professional will tell you is the most significant in the United States, and that is the obesity epidemic. Obesity is not recognized as a disability, and there's a good reason for that. If you did, it would just blow everything out. We could not address it. You couldn't protect it. You couldn't fund it. There's nothing you could do. So we're in this very awkward position of having to define disability in an increasingly exclusionary manner, which really is not in the original intent. So this all is not a simple critique of disability. I'm presenting this as an opportunity to redefine it and how we address it. And when we look at redefining that population, the very second thing we need to do when we say, who in fact are we dealing with, is say, what's the best way of dealing with them? And for years, our method has been to approach these micro scale interventions, half-inch thresholds, curb cuts. And this is, everyone's got their favorite pictures of disability interventions, of ADA interventions. There are plenty of them, but they come from a specific mindset of about looking at things at an architectural scale, at a construction detail scale, and nothing else. I find it fascinating, at least, how we got here. How did ADA is used mostly as a civil rights law. How did we get here? How did this become part of the Constitution? There's very few instances of the built environment being understood as having qualities that are important to civil rights. And it's a very simple lineage. Plessy versus Ferguson was established the equal but separate clause in the 1896 that said basically you could have train cars for blacks and train cars for whites. That was overthrown in 1954 by Brown v. Board of Education, which said, in fact, separate facilities can never be equal, that you have to integrate or there's no assurances of equality, right? This all equal protection clause. Then that sort of language, that ruling in 1954 language until this moment, and many times, I sort of long for these early 60s where you had the George Wallaces. They were extremely important to change. No one today is stupid enough to do these sort of antics that bring things to a head. If you're really trying to do horrible things, you just get very quiet and no one sees you. George Wallace here stands in the Foster Auditorium and prevents Vivian Moore and John John Hood from enrolling at the University of Mississippi. And based on that, it's the 1954, the Brown v. Board of Education says we need to think about actual built things when we're talking about civil rights. This is when it comes into play. And this image kicks off not only civil rights legislation, but becomes then the basis for ADA legislation. It's a small leap to go from this to this, where the only thing you're removing from Foster Auditorium, or that architectural facility, is Governor Wallace. So suddenly we now have an idea of civil rights in the built environment, which is spontaneously created. This is the first time this has ever been linked together. And this is the image that people seize on. You don't need Governor Wallace standing in the door to prevent people's access. The building itself can do it. Very unusual in civil rights legislation, because when you go to the built environment as being the actor, as being the thing that's violating the civil rights, you have a criminal action which then has to find It's a criminal act which has to find the criminal. There isn't a George Wallace standing here anymore. So it's really interesting from a legal standpoint. The other thing that it does, is it, for the first time, Governor Wallace was pretty easy for the feds to tangle with because it's a state versus federal issue. Those are pretty cut and dry. The built environment is not a state and federal issue. It is clearly a home rule issue. The planning and design of the built environment is a local government issue. And somehow we blow through this with ADA, and we go right through home rule. The ADA is administered and required without regard to home rule issues. It's really interesting. I have a love-hate relationship with home rule, and in many ways I think ADA doesn't use local decision-making nearly to the advantage it could. On the other hand, it's sort of beautiful being able to just blow in there and do what you want, not have to put up with the NIMBY. You just do it. That's an attractive feature. So in the ADA legislation, and I'm quoting here, this is now 1990s ADA. The ADA of 1990 came out, and it's a much, much more robust piece of legislation than has ever been in place, much more robust than the original Architectural Barriers Act. When it comes out with a Congress that is mad. And they are mad because the Rehabilitation Act and the Architectural Barriers Act had been narrowed down time and time again by judicial opinions that's really tried to be practical about it. You couldn't really do this on a broad scale, so let's narrow the legislation. Congress comes in and passes a new bill and makes it entirely clear that this is not to be narrowed. And they specifically chide the justices in the opinions where they had narrowed the decision down and say specifically in the bill that at all times you need to think as broadly as possible. And that is the intent of Congress, to think as broadly as possible with ADA. And they say in there to do so, not only do they give it every single empowerment that the federal government can have, the Commerce Clause, the Spending Clause, and Civil Rights Clauses. All of those are folded into the legislation. But they ask that you do it in a way that puts the government in the middle of it, the federal government in the middle of it, and to do so with a full sweep of congressional authority. So the first thing, just when you're looking at this, just think graphically. Is there anything graphic about this image that conveys to you the powerful, full sweep of congressional authority? Right? It's like a very bad sort of preppy modular man of some kind. It's not very well drawn. What it's looking at, the kind of measurements, this is not a particularly muscular flex of the federal government. When the federal government pounds its chest and says you will not narrow, you will do whatever it takes, at every chance you will do the broadest possible thing you can, this is what it looks like. This is the graphic of the language. I mean, this is this blustery, very powerful speak. There's a lot of tough talk in the ADA. And so, obviously, we're not going to get Stephen Colbert, who's there on the Eagle, to do our graphics. We're going to look to something else. And the question I'd like to ask is, what is the look? What is the scale? And what is the graphic quality of what the ADA should be looking at? Is it the city? Daniel Burnham, very good plan there. Looks great. Galena. It is it's Galena's work, Sprawl Repair, and Alan Dunham Jones's. Is that the scale we should be looking at, the regional level? Is this what it should look like when we do ADA legislation? Or is it this, the mega region, this graphic defining the new emerging mega regions in the case? Which is the best way to exercise the full sweep of congressional authority? And I would argue that it is this. It is the neighborhood scale. It's the traditional neighborhood unit. That is the scale I think you can most effectively operate with the issue. All right, now, the first thing I'd like to throw out, a thing I'd like to throw out for consideration is this is easy. This is easy challenges. There's never been, ADA has never been more easy to take on than it is right now. Here is low-hanging fruit. On the top are the categories that are defined as eligible for disability status, and there's an asterisk next to each one that in the majority of the time leads to the decision on the bottom, which is the refusal to issue a driver's license. The federal government has very clear categories for being able to revoke your driver's license, and those categories are nearly identical to disability status. It's a pretty simple place to start a challenge. And what's the consequence of that? That real access, anyone will tell you, any old person, any disabled person will tell you that here is the issue. It's really the half-inch threshold. You know, I know it's hard to get over that in a wheelchair, but get down this street. If you can't, drive a car. I mean, if you can't get from your house to the next building, this is a tremendous access challenge. And this is one that is clearly in the realm of what the government can do. We can't revoke licenses for the same reason that we declare you to be disabled. That's easy challenge. And this, I think, is the, I don't want to get too far into this, but, and I have written on this in the book, but the, why is the neighborhood the right scale to do it? Because you have to understand that disability is an intimate condition that exists between people. It's a relative judgment about people's functioning. And the law is uninterested in just physical measures. The law goes through things that only one of the three conditions actually has to do with your physical ability. The other is the perception of your physical ability, right? So in all the literature, disability is understood as a social condition. It is about not just your ability to perform certain tasks, it's about how people perceive your abilities. So the neighborhood is the least autonomous unit of planning. The minute you get bigger than the neighborhood, you start talking about relationships that are more autonomous and are less based in that kind of relative interaction. Go down a real hole there. The also is when you get beyond the neighborhood, you're getting into an area where we know home rule doesn't work so well. Since Plato's Republic, we know that there's a certain advantage to community-based planning, and that people take a certain interest in a scale, and that correlates to a pedestrian shed in a typical neighborhood size. So if you acted at the neighborhood scale rather than the architectural scale, you have much more opportunity to bring home rule into it. We're not fighting locals who want to do horrible things to disabled people. We're drawing on local knowledge to help solve the problem. You can do that at the neighborhood scale. These things aren't complicated. They're very easy to move into our typical charrette and planning processes. There is, could go on, don't have time to today, but the need to move accessibility from a building code regulation to a zoning regulation. There's no good reason to have it building code. It needs to be zoning. The minute it's zoning, a world of opportunity exists to bring people together, to vision around it, to create plans, to include end users in the process, and to, I think, switch. A critical thing will be switching to federal performance measures rather than prescriptive standards. In other words, we don't want to see necessarily that you have a textured, yellow, truncated mat at every curb cut. We want to see that you've figured out a way to get your people around. That's a performance measure. The yellow mat is a prescriptive measure. Also at the zoning, unlike the building, you get many, many chances to attack the problem. And the first is you get the opportunity in zoning to prioritize areas. There's no reason the same code needs to apply to a farm out at the periphery that it does to a downtown next to a transit stop. These things can be modulated by urban context. The opportunity in planning to resolve things first at the block level is much better than starting only from the architectural level. We can do entry sequences. We can do all sorts of dealing with grade conditions. We can do that at the block level in a way that if you don't do it at the block level, it becomes incredibly hard to do it at the architectural level. The block is the much better scale of looking, and that we can assemble these things into our regular codes and plans. So in summary, I've tried to hit on a couple of things. That this is a big issue, the ADA. It is a real opportunity. It desperately needs to be revisited. It can't stand in the current condition it is. Unlike most forms of government inertia, the law and the Justice Department, the very purpose of a Supreme Court and a Justice Department is to turn quickly when the need is there, right? You simply, judges say, this can't hold anymore, and it switches. That is how you switch paradigms quickly. You do that judicially. That is our branch for it. This is right for that change, and the answer for both the new population that we're dealing with under the disability category and the new tools we need to market with are community level, and they're things that we as new urbanists can do very well and assist with. And with that, I'll bring on Robert.
Thank you, Scott. Well, Catherine started by talking about the issue, the fact that most of us in this room will be lucky enough to grow to a advanced old age, and that some of us will do that very successfully until the last few years, and some will work with a higher level of disability throughout some of the last decades of our lives. Scott talked about the community and the impact the community and the community planning have on your ability to maintain independence and integration. And of course, that's what all of you in the room have been involved with for many years. As Catherine said, I've been a supporter of the Congress of New Urbanism since the initial declaration, and when I was at AARP, saw that as a real answer to helping people age in community.
He's a signer of the charter.
I am a signer of the charter, and held one of my very first AARP off-site learning sessions on livable communities at Seaside, and so really enjoyed that. I have spent my career looking at how do we provide for people with either the highest level of disability in combination typically with the lowest financial capacity and means, and really looking at alternatives that allow people to remain in their homes and in the community. And most recently, for the last 6 years, understanding how to help people who have advanced levels of disability, whether they're cognitive or physical, and not only struggle to remain in the community, but struggle to remain in their own homes. And what happens to those people when they don't have the formal and informal supports to remain in their own home in the community? How do we get those people to remain in the broader community with their social connections, their friends, their lifelong connections? So we know that Catherine mentioned people's fear of nursing homes. We know that that is always cited as the greatest fear for a person as they age. And we know why, because we've all had somebody that we care about who lived in a nursing home. And I just want you to think a little bit about, right now, the person either you know who's living in a nursing home today, or someone you really cared about who's lived in a nursing home, and your feeling about their quality of life and your quality of life as a family member or friend when they lived in a nursing home. We know that large institutional settings don't deliver a quality of life we want. I started volunteering in a nursing home in high school and literally thanked God every time I was able to walk out the door at the end of each visit each week. It was a place full of good people trying to do the right things, and it was a terrible, terrible place to live. So we know that those institutions are not compatible with new urbanist communities. They're too big. They don't fit. They're not integrated. They're about segregation, not integration. And until recently, we didn't think nursing homes could be small. So we didn't think they could really be at a scale that made sense for a local neighborhood or a local community. But there's been a movement over the last 6 years called the Greenhouse Movement, which is really about totally reinventing and radically transforming the way we deliver licensed nursing home care for people with the highest level of disability. And frankly, nursing homes are also becoming the health care and long-term care setting of last resort for people with very low incomes. And that's what our country typically pays for when the need is that great. So we know we need a different nursing home. We need a nursing home that is utterly different from what we have today. And I'll show you just a very short 4-minute clip that gives you a good overview of what the Greenhouse Project looks like. I'll then talk to you a little bit about quality and financial outcomes so that you can understand how this would work in a new urbanist community and how it works financially and how it really fits with the CNU principles that obviously all of us in this room hold very dear. And then finally talking about the community integrated model and some of the policy and planning challenges and benefits of that. So just very quickly go through the greenhouse beliefs. As you came in the room, you have some of the materials, but the DVD gives you a really terrific overview of the model and the philosophy. The Generations article gives you a good sense of what a community-based and integrated greenhouse model is about. And then just several different ways to connect with us, follow us, understand what we're about, or join with us and learn more about us. So what we believe is that nursing homes remain, despite all of our work to move services into the community and rebalance how we pay for aging services. We know that at a smaller number, nursing homes remain a very necessary service for people when they're, for some people as they age. We know that we can deliver good quality clinical care in a nursing home with current practices, but that we can't deliver a good quality of life with the current system and framework for institutional nursing homes. We know that many people with skilled needs who cannot remain in their current home still want to live in a home and in the community that they're familiar with. And we, again, know that current nursing home models simply are not compatible with the new urbanist values or, frankly, our own human values. So the greenhouse approach changes three things very quickly and all at once. The philosophy of care, moving to a person-directed philosophy of care, the architecture, the environment, and the organizational structure. So at their core, greenhouses are small-scale, self-sufficient in their core operations and provide natural efficiencies which allow the greenhouse homes to be broken down into a scale that they truly are community-based and integrated. They still are licensed as a skilled nursing home, so they still enjoy all of the protections and provide all of the high-level services and meet all of the rigorous survey standards that are necessary for a healthcare model serving very frail and cognitively impaired individuals. But they are designed to resemble the housing that we're familiar with in the communities in which we live. So the model itself operates, so the environmental piece, and we'll talk a little bit about that, is critical, but it's about a third of what the model does and a third of the benefit of the model. So small self-sufficient homes, a maximum of 12 people per home. In urban environments, these are actually 10 to 12 person apartments. It incorporates a versatile, intensive certified nursing assistant role, which allows the relationships to be built between the people who receive care and the people who provide care. It provides self-management for the nursing team so that they can really get the person-directed care right and have control over that. It also provides much, much better jobs for low-income certified nursing assistants who are doing the hard work in nursing homes every day. And it dramatically reduces departmental roles and constraints. So I'm going to switch to a DVD now just so you can get a little bit of a sense of the physical environment and understand the scale and how this fits. Much of what you see was developed for rural context, so as I finish the presentation, you'll also see the greenhouse model that was developed to fit into the new urbanist concepts and patterns.
I think I was honored, really. Find a home where I could stay and live and be. When I came over here, I wanted that shared along with me, because that's been with me all my life, really. Makes me feel like I'm home.
It's much better here than it was over there. I can do more here for myself. I can walk around, I go in the kitchen.
Some milk and some butter, kind of simmering.
I love my room. I don't have to share it with no one. I have everything here to myself. Yeah, I feel safe here.
To have my mother-in-law here is the next best thing to being at home.
I'm waiting to get a cup of coffee.
It almost looks like you're walking into a living room. The bedrooms are off to the side, 10 private rooms with private baths, and there's always someone cooking. It's more of a very homey, warm setting.
The goal is a complete transformation of the way we currently deliver skilled nursing care. So we want to move from an institutional setting, the setting that when you or I walk into it, we think, please don't ever let me have to live here. And how to transform that into something warm and to create a home that you or I would walk into and think, I'd be happy living here because it's like the home I would have myself.
We don't have a nursing station. We have a little small area that we work out of in the library. We could provide just as good care, if not better, here because of the small environment, and we're interacting with them all throughout the time that we're here. And so we notice things. We notice if there's one little thing, if they've got a sniffle, we notice that. We know them so well. It's a holistic approach.
There you go, and you got a perfect pulse, too.
Greenhouse homes are staffed with a variety of different individuals who all play an important part in bringing the care and services to the home. The key team is a group of people that we call Shabazim. That's the plural of the word Shabaz. They provide care, they provide all the services that are needed within the home.
In this situation, there's nobody that gets overlooked. Nobody, because we are with them every day. And so I guess what draws me to that is that you can really be involved with them and make their life better.
The Shabazz seem to see things a little better. They know those residents so well that when somebody's starting to not feel well or their appetite changes, they know immediately what's going on. The transition I've seen has been phenomenal. I've seen weight gain. I've seen residents on puree diets who've been on puree for years come off of it and start eating regular textures. And it's things like that that make this whole concept worthwhile.
You guys getting hungry?
Once you experience the change that occurs with the elders and with their family members, it will be very affirming that you've done the right thing. The only regret that you'll have is having not done it earlier.
So the greenhouse model is really about sort of the ultimate move in the ADA, which is to keep people in their community when they need the highest level of care. And right now as a country, we typically move them to a campus on usually the edge of our cities, where it's difficult to get to them and people don't feel, the community doesn't necessarily feel welcome to continue to be attached. This is particularly true in urban areas and rural areas where those connections are very difficult to maintain. I'm going to talk to you just a little bit about the financial model and then talk to you about how these can be integrated into new urbanist communities, and also about the first community integrated model to open this last year in the United States. I'm not going to talk a lot about the operations, which you heard about in the DVD, because they're radically different in their own way, but probably not as important for the discussion that we're having here today. So in the research that you have links to in the handouts that I provided, there are three primary research articles that have been published in peer-reviewed journals, and they were trying to answer the first three big questions about the greenhouse model. And those questions were, do people like it better, which is really what it was designed as, a quality of life intervention? Is the care as good or better than in traditional nursing homes? And finally, if it's good and people like it and it's that much better, does it have to cost more? So what we found in the about 5 research projects to date, all summarized in the NIC article, is that overall the staff, the full-time equivalents, and operating costs are equal in the greenhouse model compared to traditional nursing homes. We use them very differently. We redeploy them for more effect, but they're equal or a little bit less in the greenhouse homes than in the traditional nursing homes. We have about a 5% reduction in nursing and non-nursing hours, and importantly, a 68% reduction in administrative and clinical leadership time. The median operating costs are within 0.75% of what nursing homes cost across the United States, putting us in the 50th to 60th percentile of costs. And our capital costs are actually at the low end of what people are spending to build new models of nursing home care, because we're a small and efficient and effective model that actually gets the institutional rating at a much lower cost than large buildings. Greenhouse homes are small, averaging about 659 square feet gross per person for the 10 to 12 person homes. The financial benefits for providers, and this is important for you all because this is a viable business to integrate within your communities, the financial benefits are very significant. Occupancy increases. Occupancy is what drives margins in nursing homes. Increases about 6% overall for an adopter, and private pay days, the real profit area of a nursing home, increase about 24% in the greenhouse homes. The greenhouse homes really reside at the top end of what's called culture change, and the research has shown that deep culture change, the top end of culture change, is where the real quality of life and financial benefits accrue. The model has gotten a lot of press, and it's gotten a lot of positive consumer feedback. And what the press is really focused on, as you can see here, is that it's really about creating homes for people who need institutional care. So where do we fit with the charter for the New Urbanists? And I've just highlighted the text that I think really brings home the integration and the access that we've been talking about. So a clear commitment in the charter to increasing integration and avoiding segregation by race and income. That neighborhoods should be diverse in their use and their population, and that activities should not only occur within walking distance, but especially promoting independence for people who do not drive and the elderly. And then within those neighborhoods, a broad range of housing types. And I think thinking about a nursing home not as an institution, but as a housing type as we go through the various stages of our lives is a really important switch in the way we think. And that these things are, people of diverse ages and capacities and races are essential to an authentic community. And then finally, that you don't want to concentrate institutional uses in campuses segregated from communities, that instead they should be embedded in nursing homes. So while I don't know that anyone could have been thinking about the greenhouse model when this charter was drafted, it feels very much like they were thinking about what we're trying to accomplish in the model. So how does this work? How would you integrate a greenhouse home into a community? So you want to move from the segregated institution on the left to a home integrated into the community on the right. Well, you do that in the next slide. I'll show you the scale and the sort of the architectural elements, but you do it also because we know that, as Catherine mentioned, 80% of the people we just surveyed in a national survey are worried that nursing homes will be an institutional environment that's not as comfortable as home. 67% are worried that if they live in a nursing home, they'll spend their time with people who are very sick all of their time, and that will become their world. And 63% are worried that if they live in a nursing home, they'll be isolated from friends and family. The most important consideration for active caregivers when looking for a service setting for the people that they love is that they're designed like a real home. So there's clearly a consumer demand for this type of care. There's a business case for it in the revenue model, and there's also a scale for the greenhouse that fits into the New Urbanist community. So this came out of the charrette that Catherine created in Atlanta, and DPZ provided the architectural and planning side. So our principle is that greenhouse homes need to be designed to be similar to housing options in the community. A single-family style home is appropriate in rural communities, garden apartments in suburban communities, and multi-story in urban communities. The model is to use paired homes to develop the operating efficiencies and economies and shared clinical staff to be financially viable, and we know that now to be the case. The footprints are quite small, anywhere from 5,500 square feet to 7,500 square feet for 10 people. If you stack the homes in a denser community, those footprints increase just a little bit. And in the multi-story projects that we're working on now, it's typically 2 homes per floor with a floor plate of about 11,000 square feet. Density is good for the greenhouse model. There's a notion that somehow when we get old, we'll want to move to a farm and live with cows and flowers. I think that's true for some of us, but not for all of us. We believe density is really important, particularly for all the reasons that Catherine and Scott mentioned about access and community integration. The single family, you can squeeze as close together as you can possibly figure out, and as your site allows. The multi-story and garden-style apartments, obviously a greater density. The disaggregated approach does two things. It allows a scale to move it into the community, but it also makes it a place where the community can be a part of it without the overwhelming feeling and atmosphere of disability. So it really allows community members to feel comfortable. One of the greatest joys for me in the work I do is to walk into an operating greenhouse home and see kids playing on the carpet in front of the fireplace with Legos, and having them not tugging at their mom's arm trying to get out the door as soon as they get there to visit their grandmother. So they're good for the elders, they're good for the families, and I think they're actually very good for business and marketing of new urbanist communities. So you know where we are today. We have in the scaling, we have actually, as of last week, 134 homes open across about 33 campuses, 21 states, and about an equal number of homes in development. That is good in 5 years, but it represents a tiny fraction of 1% of the people who live in nursing homes every day, about 1.2 million people. So we need to get to scale. We have all of the systems in place and now a proven model. And because we fit with the government reimbursement and all of the regulatory structures, this is something that you all today could integrate into any of the communities that you're working with or a part of. So I just want to leave you with something that's important, because often when we talk about change and innovation, it's contrasted against what we've done in the past, and people will often feel that what we did in the past was wrong or not good. We simply did the best we could with what we knew at the time, and now that we know better, we can do a lot better. And I think that's true with Congress of New Urbanism planning and community approach, and I think that's true with nursing homes. So thank you.
So, just to sum up a little, and then we'll open it up to discussion. We've seen a couple things here that, if you think back to Catherine's original diagram, the circular one, of practice, of sort of pilot programs and changes in practice, and then changes in public policy. Both the Lifelong Communities work that she did at Atlanta Regional Commission and the Greenhouse are excellent examples of that relationship. And this is maybe a harder thing to understand than you would think at first. We have many programs, particularly in aging, that fail when they start as a policy, and there's not yet the understanding on the ground to implement them. And good ideas fail as policy change without the pilot projects to begin to bring people along to understand how they're thought of. Another readily identifiable failure is pilot projects that require lots of foundation money and lots of attention and have no chance of ever being sustainable in a larger scale. Greenhouse, I mean, there's so many things in there that have occurred to make that model happen. 4 years ago even, the idea with the International Code Council or with Medicaid that you would be able to have a kitchen in the middle of a facility that people could come in and out of and use. I mean, that was a change in the International Code Council, and that was a change in Medicaid requirements. These are two hard things to do. That has opened up the door for enormous amount of change in the industry. Or the fact that working Catherine's Lifelong Communities at ARC got the aging division to talk to the planning division. And this now happens so readily and understood as so necessary that it's almost effortless. So these are ways in which pilot projects only succeeded, not because they got 5 projects off the ground or even 134, which is, though an extraordinary number, is insignificant. What they have done is change the very channels of service delivery. And that's the relationship that I think Catherine was trying to articulate. So with that, we'd love to hear what people's responses are. And keep in mind, I mean, Robert we sat in a little on the policy, the research and practice talk this morning. And again, Robert is the person. I mean, he's in D.C. and literally is checking building designs and then in front of Congress later in the afternoon trying to get Medicaid changed. So it is a real opportunity.
Yes.
mostly you're talking about building new buildings.
Yeah.
To suit this design. So it's that's obviously a very replicable model as long as you can find the site to build. Now, are you in contact with local people around the country who can do their own design work or modify your design and you finance them? I mean, does greenhouse communities, does the greenhouse project own all of these buildings? How does it work?
Sure, great questions. We are a national initiative that is really structured and designed to consult with local partnerships who are trying to create greenhouse homes in their community. So we are an add-on to any development team around the specific model and how to implement specific pieces. So we advise architectural teams on the design. We don't require a specific design. We do have a prototype that we can offer, but we actually encourage people to design from scratch because we think that's more appropriate for the community and will be more appropriately integrated. So you can think of us really as a consultant working with the project team to get this model in place. We start with a financial feasibility assessment. We help guide the project through all of the different business considerations, market studies, policy analysis, financing, financial structuring, implementation throughout the course of the development, education and staff training, and then both pre- and post-operating opening assistance. Just to quickly touch on your question, so the challenge with using existing structures for the greenhouse is that greenhouse homes, because they're licensed as a nursing home, must meet the institutional occupancy standards. So very hard to convert residentially constructed homes, and also very hard to convert larger buildings that are not purpose-built because the renovation costs typically exceed the cost of just building from scratch.
Great. There's also, this is a, yeah.
One other question. So clearly this is, you're addressing, I mean, clearly it's been made clear that we're in a heap of trouble in terms of being unprepared for and this is a major step in the right direction. What about the needs of people who want to grow old together, but who are not yet infirm?
Sure. So co-housing or intentional communities. So they are tremendously good models, and I'm guessing Catherine can comment on that. I have, in my career, tried to look at the hardest to serve. So bringing the values of co-housing and community-based care squarely into the models where people have often languished as bodies to be cared for rather than people has been my focus. Catherine has taken a more universal approach.
Well, but certainly there are great examples. In fact, we probably could have spent 3 hours just kind of giving you a nice survey of really innovative work. And so I kind of blew through 2 decades of innovation by just saying there's been a tremendous amount of good work going on. But co-housing, I mean, pretty much a whole lot of ideas have been tried. And we certainly, we've always taken the approach at the Atlanta Regional Commission, where I currently work, is that we need more of everything. You know, if you accept this premise that these are extremely diverse people, then we need lots of different models to work. And there's some great places. There are just communities that have tried co-housing, not intentionally built for older people, that were really ripe for this. And certainly we saw a lot of, you can see a lot of those examples in the West. But there's been a lot of different ideas tried. It's just a matter of most people are not aware, and most communities have nothing. And so that's kind of this place where we find ourselves in now, is how do we get to a place where this stuff is rolling out pretty regularly, and folks aren't saying, wow, we should really do something about this, and starting on their own. There's just too much good work that's been done.
So you all in the room today are part of the solution to this, because the way innovations spread is that thought leaders and influencers and people who are making these communities happen every day need to learn about the options, the choices, and then bring those back to the projects that they're working with. So your charge as you leave here at the end of the session today is to think about how these could be integrated into the communities and to bring those to the people who would make that decision. There is a community integrated greenhouse project open today and operating in Rochester, New York. It's 2 greenhouse homes embedded in a new residential subdivision. And those 2 homes are indistinguishable to sort of the general public from the other homes in the community. I think those of us in the room would get that they're a little bit bigger and probably different for that reason. But this is being done, and it can be done. And so what I would say on the scalability issue is all of the systems are in place. We've done the work to make sure these fit with rules and regulations and building codes and all the rest. So this is really at the tipping point of a rapidly replicable model. You would need to find a service provider to integrate this. I think the business case is strong. People are moving to communities, often with adult parents who they are trying to understand how they will bring them with them, or adult children with parents who need assistance and support. Having the availability of a radically different, high-quality nursing home embedded in a community might be an additional selling point for those communities. I think we had a question from you. Yes?
The same issue of integration of communities. I guess it's more of a comment, but I love how you could, there are lots of different design models for different contexts, and I was kind of wondering if you could put that in the promotional materials, because it looked like a fantastic internal environment, but if I were thinking about living there or putting someone in there, I wonder, like, could I look out the window and see real life happening? Could I, walk out with the accompaniment and, go down the sidewalk? So I guess it's more of a comment. I know you can't have a one-size-fits-all model, but if that were part of the approach to put these in where they were part of the neighborhood, more interaction there.
Yeah, I think that's an incredibly important point. So I think you asked, how do we decide who we work with? We do a lot of work to get the word out, and then people approach us. And many of the people who approach us still have a very traditional view of neighborhood planning, suburban planning. And I often challenge that, so people don't want to be in the middle of a farm. They want to be able to see life on the street, and they want to be able to actually roll down the street. So we are working with some of the village projects that are opening around the country to make sure we have this embedded in existing residential neighborhoods, and particularly working closely with Capitol Hill Village in D.C. The challenge, and I think this is really where I'll have to rely on you all, is to convince people that communities and people want different types of communities, and that nursing homes can be then included and integrated into that. So I fight every day this notion that you want to turn the back on the street and you want to move the building away from the street. And I push people to do that, and I think am successful to some degree, but I really need your all's help in making that argument, because people still believe suburban communities need garages at the front and streets.
I'll add to that. I've worked with enough of the new urban developers now to tell you, everyone sees there is a potential market here, but when you talk about nursing home, there is a very 1950s idea about what sells community, and it revolves around children, and the idea of getting older in need of skilled nursing is a killer for a market. It's considered that way. But that is changing. If you think of Catherine's slide there with the sexiness factor, that is an attitude that's changed completely, and that more often than not, what people are looking to as they move to, after they retire, is not a place that is a senior home or a senior facility. What they're looking for is a place where that's nearby and is ready if you need it. And so what's not, I think one of the things that doesn't come across strongly enough maybe in the greenhouse promotional material that is very valuable to CNU is the effect this has, not for just the people that are in it, but the effect that it has knowing that it's there and that it's part of the community without looming large over it. It's this gravitational force you're being sucked into as you get older, but it's there if you need it. It's empowering. It means you're better able to be in that community. And that our developer clients, we're still having a hard time getting that across. Alan?
Could you, and Catherine, Robert, thank you so much for this, but I wanted to go back to your discussion of civil rights. And where are you trying to go with this? Is it to say we should try to essentially go for use civil rights legislation to get us to kind of inclusionary zoning? Every community has to provide
this inclusionary zoning problems within the ADA are an effortless. All you have to do is move the focus to zoning, and right now all ADA is empowered it's utilized by this public accommodation idea, and there's no requirement for public accommodation in private residences, and therefore there's no reason to have housing diversity. It doesn't have to do anything. It doesn't want to, right? But if you look not at the unit in the architectural detail, but look at the zoning practice, right? Then that is public accommodation. For public to explicitly exclude certain income ranges, certain family structures, that is, in the ADA context, quite simple to take on. The only thing you have to do to enable that mechanism is move out of building code into zoning code. And it's an obvious next step, and it opens up a world of possibilities.
So I'm just trying to sort of imagine, help me, so zoning codes would include language
Oh, yeah.
like what?
We're working with the Global Universal Design Council to do a universal design certified planning process. And that's the very first thing, is that you certify a process that has performance measures, not a prescriptive standard. It's unbelievable the feds try to generate details and send them out across America. The appropriate thing to do is what you do in it's what you do in education, and seeing whether you have the localities do a plan, and then you measure the performance of it. You don't send out prescriptive measures. So, of what's that?
Well, one of the prescriptive measures.
Oh, all
If we were to write a code,
right. The UDA, and I can go into this in more detail, but the universal design process that we developed for a universal design approach to planning, the first thing it does is stipulate who's the sort of advisory panel, right? And that has to contain, the panel itself has to contain folks of various abilities and skills, and then there are things that have to be looked at. You have to look, the time to look at wheelchair accessibility is when you're laying out the block structure, when you deal with the grade. By the time you've got a lot on a block, and that's a very hard place to start from to try to make a zero-step entry, you look at the full block, and you make sure that your alleys are loaded, you make sure that the block is turned right, and that there are patterns available. The Ed Steinfeld has a pattern book of various examples of ways that you can provide a simple pattern book of entry sequences for an entire block based on the specific grades there.
And Scott, can I just jump in, because I've heard you talk about this a little, and I think it's really a brilliant breakthrough sort of shift in how we address this. And you can certainly see that you could easily go from the principles of the ADA to talking about things like density, exclusionary zoning, large lot zoning, and where those violate people's capacity to have access and integration. And
it's sometimes through negligence, and sometimes plain out. I mean, that's what the policy is intended to.
So I think, sometimes you have kind of breakthrough moments and ideas, and we do that all the time in civil rights with concepts taken from one area to another. So I think the idea that zoning is a barrier to accessibility and integration is a really fantastic frame to look at this. And I think it opens up all kinds of things in code, drafting codes and drafting code revisions.
Would you go so far as to say that ADA would empower you to require that you shall not build more than a quarter mile from services?
I think that's a performance measure would be that, yes. I think you have to modulate requirements. And here again, there's this issue of the circle of practice and policy. With the ADA stuff, the strategy is get the universal design to the Universal Design Code Council, the Universal Design Commission, get the ANSI certified process that works at a zoning level, at a planning level, right? Get that going, show us the success. We've got it in one area now. Get them interested in it, and then bring that along, and hopefully bring the Justice Department very easily to adopting that. It's a small world, actually, that does the ADA stuff.
So
it's not that many people.
And the beauty of a performance standard is people may be very creative in other ways of finding to address it. but it does tend to drive things. So it may be that the easiest way to meet the performance objective is that nothing is further than a quarter mile from a village center or a retail center. But it also may go to transportation in rural areas and combinations of physical and service environments.
Right.
And I just want to add, from our perspective at a regional commission, we have to do both of these things, right? So because as powerful as the greenhouse model is and how we need one in every neighborhood in our 10-county metro area, that wouldn't be enough without addressing some of these things that Scott is talking about and the really kind of innovative, and I think, as Robert is right, it's a very breakthrough approach to thinking about these things. And there are entities like in the similar position that where I work at, is where you really need to continue to do both to do justice to the people that you're supposed to be serving. This was the goal all along. So it really is, I think, was fun today to spend time putting them side by side because they are critical. And you've had a question for a little bit.
If I may, as a volunteer, I'd just like to, quickly point out, if you're here for the continuing education credit, the sign-up sheet is over here. Please, if you were here for that, don't leave without signing it. That was the main thing. Though I did want to sort of add, I know we mentioned the villages model, and I don't want to suggest that what I am about to say is actually a barrier to doing this, but I'm from Central Florida, where we have the villages, and
Different
I
villages.
can tell you that it has created a voting bloc that occasionally votes against the interests of long-term community planning. And
so we could not agree more. There's actually two village projects.
There's the
we
very
should have
famous
cleared about.
villages. That
The
you're talking-
villages.
And then there's a new villages thing that
Yeah.
really
So,
Robert
so,
oversees.
yeah. So thank you actually for the question because other people may have had the same impression. The village movement that is really sweeping across the United States is actually community members banding together in their neighborhoods to create service and service connections to help people remain in their homes.
It's the Beacon Hill model.
And if you go to Village to Village Network, just Google that, it'll pop you right up to the site. There's, I think, something like 80 or 90 in open or in formation. They're designed not only to keep people at home, but also to keep them in their community, both low income, upper income, and middle income.
And by the way, if you want to see an interesting model for CNU, if they want to go to scale, look at NCB Capital. Look at what they do. I mean, they're sort of the hub now with the Villages Network, the Village to Village Network, and the Greenhouse. NCB Capital.
Yeah. If you go,
they're an incredibly interesting organization.
If you go to our website, which is on the materials, NCB Capital Impact is the nonprofit home of the Greenhouse, so there you can just cross-link right over to NCB Capital Impact.
B
like as in
Bob.
boy.
Yeah.
Yep. Yep. And I have cards if anyone would like a card.
So is NCB Capital doing anything with pre-infirm aging?
Yes. So we are a nonprofit that focuses on the problems caused by poverty in the United States. Our mission is to partner with communities to help people reach their highest potential at every stage of life. The areas we work in currently are healthcare clinics for underinsured and uninsured individuals, so federally qualified health centers. We work in education, giving community choice through charter schools, a somewhat controversial issue unless you do it for very low-income, disinvested communities, and affordable housing and economic development. We're located in Washington, D.C. We're actually a D.C.-based not-for-profit and sadly located right next to National Airport in Washington, D.C., not a New Urbanist community.
So we hope Jackie?
I'm just thinking of something, and this is at this level, not the nursing here, but there's a group, I think it's called Osher Lifelong Learning. They're connected to colleges. Is that, you know that?
Yeah.
Because there's a community in South Carolina called Patrick Square. It's in Clemson, South Carolina. And Clemson, I guess Osher Lifelong Learning has to be connected in some way to a college, but they're not. What they do is provide courses during the day, and so they're not specific to seniors, they're just convenient for seniors. And what they did in that community was get Osher along and had a community building built that they use during the day, but the community can use when they're not using it. And it's a great multi-use. I think Historical Concepts did the building design, but go on the website and it'll tell you some more about it. But I know it's not specific to what you're doing, but I think there's some things that, and they've had their buyers are very much people who might have retired to some of the lakes up there, and now they're getting older and they want to come in closer to Clemson. And there's also a bus that comes by and takes people to Clemson, downtown.
But I mean, you're getting at the heart of it, right? Which is, I mean, he said we're in a heap of trouble. That would have been one way to summarize about all of those slides I used. But it is all about that word that gets overused, synergy, right? But your example is exactly right, where it's a multi-use community center. It is people being you inserting a multi-generational component. It's all this stuff, and it is extremely attractive and makes so much sense. And in a world of decreasing resources, it's about spending the money in the right way, not just spending it the way we've always spent it. So
it's kind of too bad that we don't have numbers that show multi-generational event, multi-family. I'm saying the right word. Help me here. Mothers and fathers, sisters and brothers that move into traditional neighborhood developments and new urbanist communities. It's huge. I can tell you from salespeople and dealing with them all over, it's a number that we should recognize and realize that that's a component that's a benefit. And we see it over and over again at many of the communities.
So I'm sure many of us in this room are in the same situation. My father's 82. He's moved to Washington to be close to us. But if my partner and I move again, we'll need to move to a community that has long-term care available, as well as accessibility for him to live in our home. And I think there are lots of people from 50 to 70 in that same position.
And that's the shift that new urbanists, I don't think of. They're still orienting around the idea that you don't have to, the kids can play there safely. And in fact, more of the market is being driven now by
that example. Well, thank you so much for spending the time with us. This was fun to think about with you.